Do you like the sound of a laser that is no pain, no downtime, and it banks your collagen? I've come to the atelier by Dr. Aggie to find out about the RedTouch Pro, which can do all that. Collagen loss is one of the key things that a clinic like yours is having to tackle. And it starts a lot earlier than we think, doesn't it?
It's often surprising for patients when we discuss what happens with the collagen. And actually, they're quite surprised when I tell them that we start to lose our collagen in our mid-20s. We start to lose about 1% per year from mid-20s. And then we go through the very kind of more leveled decline until we get into the perimenopause and menopause time. And in the first years of menopause, we lose about 30% of collagen.
It's huge, isn't it?
Yeah. And by the time we're 50, we have half of the collagen that we had before.
Okay, so ideally, it's got to be about prevention, hasn't it, rather than treatment of collagen loss?
Absolutely. As always in medicine, prevention is better than cure. We have better result. We can maintain how patients look like in a less invasive way if we start early with very strategic procedures, and then we can actually not only preserve but also maintain and stimulate the collagen and control the way the skin is changing.
There are so many collagen treatments already, so what makes this one different?
It is a very different approach. I was really excited when Linton has contacted me and told me about this new technology, because it allows us to have this proactive approach in terms of prejuvenation for younger patients, where we can actually protect and stimulate the collagen before it starts to decline rapidly, and rather than wait for the damage to happen and then start to reactively stimulate it with more invasive treatments, we can now in a very gentle way protect this collagen and maintain it for years to come and actually control the aging process for those patients.
And are you finding younger people coming in wanting this sort of treatment now?
Younger generation is very well educated now.
Okay, so they're not going to just let it all go like my generation did.
No, they're very well informed. They're very well informed about the skincare, about prevention measures, about using SPFs, etc. So they come already thinking, what can I do now to control this process? They want this information, and they want strategies to help them maintain the way the skin changes. And luckily we have the technology that can help them now.
And is this a treatment that also works for the older face that has lost a certain amount of collagen?
The beauty of incorporating this laser, this device, within the other clinic treatments is for someone who is already in perimenopause, in menopause or after menopause, we've already lost some of this collagen. We need to stimulate it again, and yes, we may need to do it with a little bit more aggressive approach. Microneedling, CO2 lasers are different, radio frequency, ultrasound, different ways of doing that. But then we really don't want to wait for the peak that we've achieved to start to go down again and have another aggressive treatment a year later, 2 years later, when actually we are 1 or 2 years older and our collagen production has declined even throughout this period of time. All the benefit from this treatment will be maintained by something that is completely non-invasive, by the laser that doesn't cause any discomfort, any downtime. There's no need for anaesthetic, there's no need for any kind of cover-up even afterwards, because the patients are not even red. How are you feeling?
Fine, nothing.
Amazing.
So Aggie, from a technical point of view, what makes this laser different to the ones that do cause pain and require downtime?
This laser directly stimulates collagen, and this is the first laser to do that. So they found out the specific wavelength to directly stimulate the collagen. So the collagen is not being stimulated through trauma, through heating the tissue. Here, we're going directly for the collagen, and this wavelength is precisely stimulating collagen fiber and making the fibroblasts to produce more of this collagen.
What kind of results can it give on different faces?
We have 3 pathways really with this treatment. One is the prejuvenation, younger patients, very first signs of aging, when they start to be a little bit worried about, well, what shall I do? What can I do now to maintain the way I look? And these patients would need 3 to 6 sessions per year, and as long as they do it, they will maintain the level of the collagen.
Wow.
Then we have the second group, which is, well, we've lost some of this collagen already. We need to boost it a little bit more, but we want to maintain this level in between those treatments or delay the gaps in between more invasive treatments. And that is very reassuring for patients because they feel like they've invested quite a lot, not only financially, but also sustaining, you know, the downtime and all of the stress related to it. But then if they can have a little bit more longevity out of it and protect what they've so hard worked for, that is also a lovely way to do it. The third group is also very interesting. These are the patients that would traditionally be eliminated from laser treatments in general.
Okay, like
patients who are too sensitive, they have a little bit of, you know, very sensitive skin, melasma potentially. Patients who are not traditionally good candidates for laser and light treatments.
Yeah.
All of a sudden, this group is not only benefiting from this laser because it doesn't heat the tissue, it doesn't cause micro-injury, so it doesn't cause them any more problems that they already have, but actually because of the effect of collagen stimulating on the walls of the vessels, it makes them stronger and therefore downregulates the inflammation. So we see patients with rosacea, with melasma, with very sensitive skin to have improvement by making the skin healthier, by making the blood vessels healthier in the skin. We are improving the appearance of, we cannot cure it, but we can improve the appearance of melasma, which is amazing because those patients usually would be excluded. And this is the inclusive way of actually, yes, you can be a good candidate for this treatment because you have melasma. Actually, you will benefit in 2 separate problems that you have.
2 ways, And what's it like to have the treatment? Is it a long treatment, a short treatment? You say there's no anaesthetic. Is there really no pain?
There's no pain. There's no pain. There's no prep. We don't need anaesthetic.
How is there no pain? Because is the collagen layer so specific?
There's no trauma. There's no heating. And direct stimulation of collagen. So again, we're not doing it through a secondary approach of let's cause a little bit of micro-injury, micro-trauma, and then that way stimulate collagen production because the skin will try to rapidly heal from it. We're bypassing it, we're going straight to collagen, and therefore there is no discomfort.
In terms of the results that people can get, it's not going to be a dramatic transformation of any sort. But is there anything visible, or is it just the knowledge that your collagen is going to be that much more secure and stable?
I think we have to manage our expectations with this one because it's not something that will give a transformative result.
Sure.
But as I like to compare it with my patients as with microneedling, for example. Traditionally, if you eliminate the downtime and the discomfort and the need for anesthetic, and in the end patients will experience the effect of collagen stimulation, which is the glow, the healthy looking skin,
a little bit firmer, possibly a bit tighter, but nothing
nothing transformative, but this really healthy looking skin. It is exactly what we after with this laser. It does literally give you this healthier, bouncier, more glowing looking skin, the more youthful looking skin, which is the holy grail, isn't it?
I'm looking at your lovely, healthy, glowing, radiant, bouncy skin. So people are doing this for prevention, they're doing it for maintenance of their collagen, but you've got some pictures, I know, that can show what's actually happening.
This is the skin before the treatment with all of the type 1 collagen, which is still there, you know, this is a decent amount of collagen, of type 1 collagen, but this is after the treatment. You can see how flared up those fibroblasts are, how much more of the yellow bits, it's the collagen 3, it's the youthful, the baby collagen. This is what we are after. So that's how the laser is stimulating the new collagen production. You can see the glow, you can see a little bit less redness, less pigmentation, so the inflammation becomes a little bit less obvious.
I mean, there's no redness or anything, there's no discomfort.
No downtime, no discomfort, you look like nothing ever happened.
Very good, but definite collagen stimulation to come. Okay. So that was the RedTouch Pro. Very quick, very easy, no downtime, and exactly what's needed for banking collagen. So it's brilliant for prejuvenation if you're younger, or maintaining your collagen levels if you're older.